Good afternoon, everyone. Welcome to this day surgery urology section meeting. I'm glad to see a wonderful work by the organizers in putting up this agenda covering various daycare surgery aspects, especially in urology. We have already seen a wonderful presentation on ureteroscopy techniques. I'm going to go through few recent advances, especially in the direct insuction scope techniques and also flexible and navigable access sheet scopes. They play a very important role in setting up a day care surgery. It definitely has an impact in improving the patients getting discharged in the same day. I'm Ananda Dhanasekaran, a urology consultant from Midlands Metropolitan University Hospital. You can see the hospital in the background. I congratulate the BADS for putting up such a nice agenda. Let's dive into the presentation. Disclosures. As you know, disposable scopes in UK is predominantly from Pusan, distributed by CJ Medical in UK. And also there are scopes available from various others marketing people like Rocomed. I am a trainer and I did some webinars for those two organizations, but it has no direct impact on today's presentations. But I'll be using some of their products to demonstrate the concept. I'm also a mentor and proctor for Teleflex, Olympus, and Boston Scientific, but it has no direct impact with today's presentations. The disposable ureteroscopes have become much more common now. Just like how a new technology like laparoscope or robot had the initial challenge of why it is, whether it's needed, disposable scopes have the same challenge. We always felt the price is a bit out of proportionate and also we are worried about the environmental impact. But one way or another, now it's become a bit norm and disposable flexible ureteroscopes are not available in much more less caliber like 7-point French, which makes daycare ureteroscopy in unstented ureter a bit of a reality. There are also disposable flexible cystoscopes and also disposable flexible bronchoscopes. We can see in today's agenda there are lots of presentations on anesthetics and possibly the bronchoscopes will be an interesting one for the anesthetic colleagues. The single-use flexible video ureteroscopes are now available predominantly in 7.5 French and 9.5 French. Even though the miniaturization is the term for this decade, there is a bit of a comeback in the 9.5 French because of the new concept of in-suction ureteroscopes. The in-suction ureteroscopes gives us the ability to use the suction during the procedure by a separate channel. Even though the working channel is same, as you can follow my arrow, this is the port where we can connect the suction. Since the working channel is same, when you are using the irrigation, you can't use the suction on the same time. So whenever you need to use the suction, you need to close the irrigation. Otherwise, the irrigation will be sucked outside and you won't get the desired outcome, obviously. The new scopes has got a good straight channel for the laser fiber to go without any bending. It has got the integrated T connector which keeps the laser fiber in place and also available to pass any other accessories like baskets or guide wires and also prevents the leak. Ergonomic handle and the scopes are quite robust and kink resistant. The new 9.2 French with the in-suction apparatus gives us the much more ability to create a better suction, which I will be demonstrating in the future slides. Similarly, cystonephrovideoscope is available with the same principles, which you can use it either for cystoscope related things like cystolithotripsy or even for PCNL to reach the different calyces. This makes less need for multiple punctures and PCNL also can become a daycare procedure. These are the various parts of the scope. The predominantly important one are the suction port and the irrigation port. Otherwise, the deflection, ability to bend are all become very norm, and that won't make a big difference because now most of the scopes comes with a very good deflection angle and reachability. It's portable, enhanced sterility, pre-packed, high visual quality, fully digital, ability to record the procedures as you need are the main advantages. Excellent flexibility and maneuverability with ability to have good vision, and the suctioning device will make a big difference in the future also. So this is one of my patient where you can see that a very simple arrangement. There is a safety guide wire as you can see, and this is the flexible and navigable suction access sheath with a separate port. I will show it in a different picture, and it's quite easy to handle. A single person can do the procedure. The accessories like laser fiber will be held in place by the screw type of holding so that you don't have any leak. The irrigation port and the suction port, and we can use the pathfinder as we need. So this is another angle which shows the flexible navigable access sheath and also the ability to perform the suction with just a single finger. Good image processor, you can go for a separate monitor, or you can use just a transmitter so that it can be connected to your own stack system. Coming to the flexible and navigable access sheets, this is another good game changer where the access sheet can be taken to the different calyces. Previously, we used to keep the access sheet below the PUJ. During my learning days, the teaching is don't take the access sheet into the pelvis. It will decompress the pelvis and you won't be having enough vision or the place to work. But the same principle applies even now. Keep the access sheet below the PUJ, do the fragmentation, and once you fragment, you can take the access sheet into the renal calyces to clear the stone fragments. So this flexible access sheet can be connected to a dedicated container where the stone will get connected, and it's a 6 centimeter flexible tip, and stone filtration collection bottle is available. And this is how it looks in the real time. We can see that there is a good flexion available, and it's a kind of a passive flexion. There is no separate lever available for you to flex, but once you keep your flexible ureteroscope inside, along with that, this will flex. This is a good video to demonstrate the suction capacity using a flexible navigable access sheet. So this is from a different product, thus to create a uniformity and unbiased presentation. So with the ureteroscope, you can bend the access sheet and initially go and locate the stone, use the laser to break the stone, and when you are breaking the stone, if you have the access sheet on your side, as you can see, it creates that negative suction. I will say any fragments in the region of 100 to 200 microns can easily go between the space of the access sheet and the ureteroscope, while the bigger fragments you can take it with a negative suction, and in the Y port you can take them out. There are other products also available like Clear Petra, which most of you may be quite aware of. And this is a video from Professor Somani. Thank you for sharing that. Here you can see that the stone is broken with an excellent vision. He is using a dusting technique with some fragments producing, and as he is dusting and fragmenting the stones, you can see that the stone particles are flying towards the scope, and the small particles are obviously disappearing straight away. That's because that small particles are traveling outside between the space between the access sheath and the ureteroscope. It really helps in, to certain extent, a quicker stone clearance. but in major extent in reducing, keeping the intrarenal pressure low. Keeping the intrarenal pressure low is very important to prevent postoperative sepsis and indirectly helping in daycare surgery and safe discharge on the same day. This is a nice pathway from Professor Joe Philip from Bristol, published via the Grift case study last year, showing how an acute stone service clinic pathway can be set up with the integration of the stone MDT and hot stone surgeries, both ureteroscopies and ESWL, maintaining a day care pathway. This kind of pathway with the help of the Grift is now getting the momentum, and many stone services in the UK are establishing their own daycare pathway. This single-use scopes advantages and disadvantages were published in BJUI Compass last year, 2023. Even though there are plenty of advantages like can be used in a difficult case, there is no need to worry about the breakage because end of the day it's a single-use scope, very good for training so that the trainees can start using the flexible ureteroscope from quite early stage. Quite useful for large complex cases with the kink or large volume stone. The cost effectiveness was initially a big challenge, but believe me, the cost has radically reduced because of the competition and availability of products by different marketing people. Gone are the days where you need to spend 900 to 950 pounds for every disposable ureteroscopes. Now the prices come down to the region of 300 or 350 pounds. And the disposable cystoscopes are trending to the region of even 85 pounds or 90 pounds per piece. Obviously, there is a disadvantage, like for example, environmental impact. But again, the question is, even the Tesla car has got big batteries, and what's going to happen after the batteries, and reusability of the disposable material has become a very big discussion. Even a reusable ureteroscope, when it goes to the sterilization cycle, it produces good amount of waste fluid with chemicals which can have a carbon impact. We can discuss the carbon footprint impact of the disposable scopes throughout the day or even for the whole week without any proper outcome. So I will focus my talk on how to safely improve the chances of daycare surgery for complex ureteroscopies using these newer innovations. If somebody wants to have some good references, I will point them to this publication from Professor Bhaskar Somani Group on single-use flexible ureteroscopies, effectiveness and current technologies. They also published a very nice review comment on BJUI on the innovation and development of the ureteroscopies. I'm sure it's difficult to read, so I will take you through the actual publication. So they've gone through the whole history of the innovations in ureteroscopies from 1954, right from Hopkins optical glass fiber bundling. And then the article nicely takes us through the slow improvement of the maneuverability, decrease in the scope size, improvement in the vision, robotic flexible ureteroscopes, even though that part is still in a very infant stage, use of good working channels, use of the disposable scopes from Boston Scientific in the region of 2018 under the name of LithoView. And the latest one in 2023 is from the Poussin of in-scope direct suction, which is what we are discussing today. And I will take this arrow further to 2024 this year to show the presence of the flexible navigable access sheath as I have discussed. Thank you. In summary, the new innovations of in-suction flexible ureteroscopes and flexible navigable access sheath makes the daycare surgery of ureteroscopes more feasible, more safer. Chances of sepsis is less because of less intrarenal pressure. This helps us not to make the daycare surgery only just for pre-stented or simple ureteric stones. We can even do complex ureteric stones or even small volume PCNL procedures as a daycare procedure. Best wishes with the rest of the meeting. Thank you.